all this healthcare. And no matter how pure the ideal is to try to do this with healthcare, we can't afford it at this point at the rate we're going unless we do something different. We can't increase the amount of medicine that we pay for without doing the lifestyle. We got to stem the tide somewhere. You know, it's a whole thing about supply and demand. We've got to decrease the demand somehow, and this is how we should do it. So if we look at that, 70% of death, as well as 75% of our $2 trillion healthcare bill is from chronic disease. That's all 70 to 80% of it, at least, is preventable. Okay, 96% of Medicare costs and 83% of Medicaid costs account for chronic disease. So we've got to do something about that. So let's talk about aging, what that is, and how does that happen to us? And part of it, it doesn't just happen to us. That's, if I get nothing else across, it's like you should be empowered to go and do this yourself. And you can research it, and you can do a lot on your own. If you need, help to go do it, go find someone who understands this. Sometimes it's your regular doctor. Some are more and more getting educated about this, or a specialty clinic like ours. Oxidation, stress, that causes us to age. Glycation, which is literally the glucose sticks to your cells, it sticks to your proteins, and literally gums up the works and makes things not work. Which actually also increases inflammation in the body. There's something called silent inflammation, and then there's the inflammation that you feel, the aches and the pains and those sorts of things. Very important. There's a lot of focus on cholesterol for heart attacks, so I'm sure James Gandolfini had high cholesterol probably. Well, 50% chance he had a cholesterol problem. There's a 50% chance that he had normal cholesterol and still have a heart attack and die. Cholesterol is not the whole story, it's the inflammation. And so, but a lot of focus on cholesterol because there's very good studies and there's also very good medicines for that. So we know that there's a lot of money and research that has pushed that forward above the other things. Neuroendocrine decline, so it's another one of those big words, but it just means hormonal balance. The hormones in our body are in constant flux, and that balance is what affects our metabolism and our health. DNA damage, and so it really all comes down to what keeps your cells alive is your DNA. And so we'll talk about that, and we'll focus on those two, because all the ones on the top, as we'll see in the end, they all impact what's going on in our cells, and that's what's aging us, and that's what's giving us disease. So what do we do about this oxidation of these free radicals? Well, we avoid the things that cause it. Smoke, sun, toxins. Some people will key in on the fact that it says over-exercise, so that's true. So that's the right amount. So they go, oh, I don't want to exercise, I'm going to get those free radicals. It's like sitting in church, everybody's going to hear it their way. I understand that. But putting that into perspective, stress management. We see tons of stress-related illness in our practice, whether it's chronic fatigue, chronic pain, hypertension. So you just got to know that, because you're in a stressful world. And so stress is not bad, because that's what drives us to be successful. So it's how you handle that, how you channel that, and how you take time for restoration and take care of yourself. So eliminate those things. Glycation, just a big word for you get glucose gumming up the works. The carbohydrate sticks to everything. There's something called hemoglobin A1C. And when we think about that, it sticks to your red cells, but it's really sticking to all of your cells. That's just one of the measures we use to look at that. And a lot of that's nutrition, what we take in our diet, and refined sugars, of which basically bread and wheat is one of those. We think of that, some of those as complex carbs, whole wheat, but it's really, come to find out, it's a little bit of a myth. And we really break down those carbohydrates very quickly, and it acts like a simple sugar in the body. Excess body fat, and manage that. So if you've got it, management. We do tests that look at, we can predict, 10 years before people get diabetes, and there's things we can do about it. I see people come all the time with abnormal glucose, and so I said, well, so what's the plan? What have you been doing about that? What does your doctor want to do? Well, we're going to watch it. It's like, we're going to watch it for 10 years until you get the diagnosis of diabetes mellitus, and that goes down the chart, and then you go. I don't like that. I want to head it off at the pass. Inflammation. Inflammation can come from our environment. A lot of it comes from our food. We have a very inflammatory diet in this country now, probably because we don't get enough omega-3s. So if we're talking about my favorites for supplements, omega-3s is one of my favorites. Vitamin D is another favorite. I guess I got a lot of faith. But that's very important for helping with inflammation in the body, cholesterol management, and managing your stress and your hormone levels, because we know that those actually affect us for inflammatory balance as well. So people think about when I say the word hormone, men immediately think of testosterone, yes, or women that they're estrogen because they're having their hot flashes or whatever. But there's lots of other hormones that are in the body. Insulin is a hormone. We forget that. Cortisol is a hormone. It's a stress hormone, and so that's a big one these days. And so probably the majority of people we see by the time they come have abnormal stress responses in cortisol. And so that's really a bad player in you as far as your brain and your metabolism. So there's some natural ways to keep those in check. And then the DNA damage. So DNA is really, we thought with the Human Genome Project that we had it down, that we were going to figure that out, and we would predict every disease that you would ever have. But it's really more complicated than that. There's something called epigenetics that now we see all the interplay. And obesity is a good example of that. So we see a whole generation of people that now are obese that didn't come from obese parents, but now we're seeing that if you are obese, even if your parents weren't, then now you have increased chance of your children being obese because it changes your metabolism, it changes your, what we call epigenetics. So that's another good reason why we need to get a handle on this, because we're going to have, this is the first time we're going to have a generation that's not healthier than the generation before.